Welcome back to Med Madness, the podcast where we delve into the complexities of medicine, one condition at a time. Today, we're exploring septic pelvic thrombophlebitis, a rare but significant complication often associated with pelvic surgery or the postpartum period. Septic pelvic thrombophlebitis, or SPT, involves an infected thrombosis within the deep pelvic or ovarian veins. It's a condition that can be easily overlooked, yet it holds serious implications if not identified and managed properly. Let's dive into the risk factors, pathophysiology, presentation, diagnosis, and treatment of this intriguing condition. First, let's talk about the risk factors. SPT is commonly seen in patients who have undergone caesarean delivery or pelvic surgery. Conditions like endometritis and pelvic inflammatory disease also elevate the risk. Pregnancy itself is a notable risk factor, given the hypercoagulable state that it induces. This means the body is naturally more prone to forming clots. Additionally, malignancies can predispose individuals to SPT due to both the disease process and treatments that may affect coagulation. Now, the pathophysiology of SPT is multifaceted. It starts with hypercoagulability, a hallmark of pregnancy and certain malignancies. Pelvic venous dilation, particularly prominent during pregnancy, contributes to stasis, a critical component in thrombosis formation. Vascular trauma, whether from infection or surgical intervention, further exacerbates the risk. These factors collectively create a perfect storm for thrombosis and subsequent infection. Next, let's discuss how patients with SPT typically present. They usually have a persistent fever that is unresponsive to antibiotics. This fever is often the only symptom, as there are no specific localizing signs to pinpoint the infection site. Diagnostic evaluations, including blood and urine cultures, often return negative results, making SPT a diagnosis of exclusion. It's essential to consider SPT when a postpartum or post-operative patient has an unresolved fever despite broad-spectrum antibiotic therapy. The diagnosis of SPT hinges on the persistence of fever after ruling out other potential causes. Since the most common cause of postpartum fever is endometritis, empirical treatment with antibiotics is usually the first step. However, when the fever remains unresponsive and infectious evaluations are negative, SPT should be suspected. Treatment of SPT involves two main strategies: anticoagulation and broad-spectrum antibiotics. Anticoagulation is crucial to prevent further clot formation and manage the existing thrombosis. Broad-spectrum antibiotics are necessary to address any underlying or persistent infection. This dual approach ensures comprehensive management of the condition. To illustrate this, let's consider a real-life case study. A 32-year-old woman underwent a caesarean delivery due to fetal distress. Post-operatively, she developed a fever on the third day. Given the context, she was started on broad-spectrum antibiotics for presumed endometritis. Despite this, her fever persisted. Blood and urine cultures were negative, and there were no other signs pointing to a specific infection site. After several days of unresponsive fever, her medical team considered the possibility of SPT. Imaging studies confirmed thrombosis in the pelvic veins. She was started on anticoagulation therapy alongside continued antibiotics. Within a few days, her fever resolved and she gradually improved. This case underscores the importance of recognizing SPT as a potential diagnosis when faced with persistent postpartum fever. Septic pelvic thrombophlebitis is a challenging condition that requires a high index of suspicion for diagnosis. Understanding its risk factors, pathophysiology, and presentation is crucial for timely and effective treatment. If you encounter a patient with persistent fever unresponsive to antibiotics, remember to consider SPT as a possible cause. Thank you for tuning into Med Madness. We hope this discussion on septic pelvic thrombophlebitis has been insightful. Stay tuned for more episodes where we unravel the mysteries of medicine. And as always, keep those comments and questions coming. Until next time, stay curious and stay informed.